everybody. Welcome to our webinar. Thank you so much for joining our session, Reports from the Frontlines, Keeping School Buildings Safe, Students Healthy, and Families Informed During COVID and Beyond. We're excited you all could join us and really appreciate you taking the time to participate in today's webinar. My name is Alex Mays, and I'm the National Program Director at Healthy Schools Campaign, which is the organization that's hosting today's webinar. For anyone that's new to Healthy Schools Campaign, we're a nonprofit that works to ensure schools can provide students with healthy environments, nutritious food, health services, and opportunities for physical activity. Our work really focuses on advancing health and wellness in schools whose students are affected by inequities in education and health. Our work is also heavily informed from school stakeholders, including families and school staff who we know are working every day to ensure that students and staff have access to a healthy school environment. And that's really the focus of today's webinar. We're going to be hearing from representatives of some of the school stakeholder groups that Healthy Schools Campaign has the honor of working with. And many of these groups have played a critical role in supporting student health and education throughout the pandemic. Next slide. Just a few housekeeping items before we get started. On this slide are just some tips on optimizing your viewing experience. So I'll give everybody a minute to read through that, adjust your settings so that you can have the optimal viewing experience for today's webinar. Our session's going to run for an hour, and we are recording it, and we'll be sure to email out that recording to everybody early next week. We're also going to save about 15 minutes at the end of the webinar for a question and answer session with our speakers. So you can ask questions throughout the webinar by typing them into the questions box located on your control panel. Send them in at any point, we'll collect them, and then we'll be sure to ask them of our fantastic panelists after their discussion. Next slide. So today's session is really going to highlight how different school stakeholder groups responded to school building closures and where there are opportunities for building on their great work to ensure that students are able to return to healthy, safe school environments. We're going to have some opening remarks from our fantastic moderator, and then we'll transition to a panel discussion. And at the end of the webinar, we're going to highlight a number of resources that can really support you in your efforts to bring some of these lessons learned back to your work. Next slide. So our plan for today is we will open up with Joaquin DeMaio from the Education Council moderating today's discussion. He's also going to provide some framing remarks. We're also joined by Eva Stone, who is the Director of Health Services from Jefferson County Public Schools in Kentucky, Kimberly Thomas, who's the Senior Director of Services for the Facilities Management Division at the University of Georgia, and then my fantastic colleague, Kenneth Varner, who's the Community Engagement Manager with Healthy Schools Campaign. So with that, I'd like to first introduce Joaquin DeMaio, who's going to be offering some opening remarks to lay the groundwork for today's discussion, and is then going to moderate our panel. Joaquin is a Senior Policy Advisor at the Education Council, where he leads projects related to advancing the science of learning and development. Joaquin is also a former classroom teacher and principal and served for 3 years in the executive branch of the Obama administration at the U.S. Department of Education. We are honored to have him as a member of the Healthy Schools Campaign's board and just so appreciate his leadership and commitment to advancing efforts to support student health and wellness. So with that, Joaquin, I'm thrilled to turn it over to you to kick off our session today.
Well, thank you, Alex. Really appreciate that very kind introduction, and it's my honor to be able to be here today to collaborate with all of the panelists, to learn from them, to learn together, and to be able to continue to do this work with Healthy Schools Campaign. It's really a highlight of my life. So I really want to be able to set us all up for success and get everybody who's on the line today situated and thinking about, what is it going to take to make sure that all of our kids, when in-person learning resumes from K all the way to higher education, that we have environments that really do optimize assets and potential for a healthy development on the part of every young person. And so to kick off that conversation, I'd like to ask everybody online today to imagine a world in which every young person's life is a succession of positive opportunities and environments for development, in which a child can come to know who they are and discover the wide range of possibilities for what they can become. Imagine different types of healthy learning settings in which those kinds of opportunities are also intentionally built and optimized, regardless of where a child lives or attends school. Imagine, too, that educators can identify each young person's talents, interests, and aspirations and align them with learning experiences and environments specifically designed to promote the well-being of the whole child. This is not the world in which we currently live, but it is the one that we can now begin to create. Building on new knowledge from the science of learning and development, coupled with a commitment to advancing equity for all students, schools, universities, and community partners can bring these opportunities to bear for every young person in this country. The need is great. Even as the United States has led the world in so many areas, it remains a country of dramatically widening inequalities, with many children and young people living in poverty and with significant adversities of many kinds, including food and housing insecurity, exposure to increasing gun and racial violence, and a lack of access to health and mental health services. During the pandemic, these dramatic inequalities in our society and the conditions of living in America have been exposed, along with the dramatic inequalities in the conditions of learning in America. The reality is that the United States education system was not designed for equity. It was designed for inequitable access to learning opportunities based on your race, your income, your gender, your language, and your culture. Indeed, it was designed to select and to sort rather than to develop potential. And through segregation, unequal school funding and facilities, and tracking systems, institutionalized racism and classism are baked into the design of the system itself. This system reinforces beliefs about who has potential and who is worthy of opportunity that we know are false, harmful, and discriminatory on both scientific and moral grounds. Such beliefs risk squandering the potential, I should say, of millions of young people each year and growing inequality in our society for the foreseeable future. The COVID-19 pandemic, the related economic recession, and ongoing racialized violence have laid bare the inequities of experience and opportunity for too many young people in our country. The inequities shaping and challenging our children's future before the coronavirus, heightened by anti-Black and other forms of racial violence, have dramatically amplified these concurrent and devastating events. These forces cry out for a redesign of all the systems and places that support our young people and their families and educate and prepare them for the future. The situation facing our country demands that we use this disruption as an empowering stimulus for transformational, social, educational, economic, and environmental change, defined by the goals of social justice, equity, and opportunity for every young person to thrive. It may be hard to find silver linings through so much suffering, but as recovery and reopening take shape, this is the chance, this is the moment to design something very different and much better for our children and all of our young people. This is the design challenge we are solving for today. Here's the opportunity as I see it. Developmental and learning science tell an optimistic story about what all young people are capable of. There is burgeoning scientific knowledge about the biologic systems that govern human life, including the systems of the brain and the body. Researchers who are studying the brain's structure, wiring, metabolism are documenting the deep extent to which brain growth and bodily development are interdependent and malleable, and this is key for this conversation, particularly sensitive to the physical environments in which young people learn and develop. Because researchers know so much more now about how the brain and body develop than they did when our education system was designed well over 100 years ago, we can now use this knowledge and the guiding principles on the slide displayed on your screen to design a system in which all individuals are able to take advantage of healthy, high-quality relationships, experiences, and environments for transformative learning and development. So today I'm thrilled to be joined by a wonderful panel who will be sharing more about what their experiences have been like over the last year, working with school stakeholder groups that play a critical role in supporting student health and achievement. We know that last year has been full of significant challenges, but we also know that we've learned a lot. And it's those lessons that we've learned that we really want to focus on today. Understanding how different stakeholder groups responded to school building closures and what policies, practices, and tools can be leveraged moving forward will help us as a community identify strategies for supporting safe and healthy in-person learning this fall and over the long run. On our panel today will highlight the perspectives of school health service providers, school facilities staff, communities, and families. As you listen to our panelists' remarks and their stories, I encourage you to think about how their experiences and lessons connect to your own and what you would want to see changed in your state, your school district, your school, or your community to support student health and wellness and attending to the needs of the whole child. With that, I'd like to introduce our three panelists before we get started with today's conversation. Kimberly Thomas is Senior Director of Services at the University of Georgia Facilities Management Division and is responsible for building services, fleet and grounds, sustainability, warehouse operations, and the Work Request Center. It's a big job. Prior to that, she spent 6 years as the Executive Director of Plant Operations at Clark County School District. Her departments have received numerous awards over the years for their commitment to green cleaning and sustainability. Welcome, Kimberly. Our next panelist is Eva Stone, Manager of District Health for Jefferson County Public Schools. She was selected as the 2019 Kentucky Nurse Association Nurse of the Year and named a 2020 Louisville Business First Healthcare Hero. That's, oh my God, I love it. Nurse of the Year and Healthcare Hero. Eva has worked in public school health for 20 years and successfully advocated for Kentucky to amend the state Medicaid plan to allow for expanded billing for school health services, which means more money goes into educating young people as a means to help increasing access to care for children. Welcome, Eva. And finally, last but not least, Kenneth Varner, Community Engagement Manager at Healthy Schools Campaign. Kenneth works with community members, parents, teachers, students, and school administrators in adopting school-based practices and policies that enhance health and wellness, with a key focus on engaging parents in Chicago's African American communities. Prior to that, Kenneth worked as a health coordinator in a Chicago public school, serving as a liaison between the school's administration and the school-based health center. Welcome, Kenneth. It's so good to have the panel. I'm very excited for this conversation. I hope you are too. And my first question for everybody, or my first question is actually for the whole panel. So maybe we can kick it off with Kimberly, and then we'll go to Eva, and then we'll go to Kenneth, and then I have questions for each one of you as well. Are we ready?
Yes.
All right, excellent. So there's a lot that we couldn't have imagined about what happened over the last 15 months. In your role and your work to promote student health and wellness, what most surprised you about this past year plus, and how did it affect your work as an advocate for student and staff health? Kimberly?
Well, good afternoon, everyone. Thank you for that introduction, Joaquin. Just one of the most surprising aspects that I couldn't have imagined initially was how delicate our supply chain is in this country. It was really shocking to find out, just what a small shift in international affairs can have such an impact on getting cleaning supplies, getting paper products, being able to satisfactorily stock the school items, medical supplies that we needed in the schools. And so it was a really huge eye-opener for just how fragile that supply chain is. One of the things that we had to do early on is to make a plan on how we were going to be able to provide the needed materials and supplies here at the University of Georgia. And we, being the flagship institution, there's quite a lot of other schools who are calling us to find out what products we have, because we do have a warehouse operation here. So it was important to reach out to our vendors, our distributors, our finance and business professionals to see how we can get outside of the traditional supply contracts to get those needed supplies. And we ended up coming up with a lot of innovative ways to make sure that we could supply our own, so to speak.
Thank you for sharing that. Eva, what was your experience like over the last 15 months?
Well, I have to say, when we closed schools a year ago in March, I really didn't have a full appreciation of what was to come and just the magnitude of everything that would go along with that. Getting systems in place to even prepare for the return to school. In my district, currently, we have 100,000 students and about 17,000 employees. So I think, first of all, just the weight of the responsibility of that and feeling the responsibility for the health and welfare of people who, not only the students and staff that would be coming back to work, but the families of those children that, in a sense, we were protecting as well. And so it was balancing that responsibility against the fact that there's so many children that lost these essential services that they receive with in-person learning. I mean, not only the instruction, the things that you were talking about, but the kids who come to school to eat, the children who are experiencing homelessness, all those things that they lost, and the anxiety that came with knowing children didn't have access to those things. And then, of course, the difficulty with reopening and all the debates that began happening and all those things, not just for our district, but across the whole country that had to happen for our schools to reopen successfully. And I really did not have an understanding of the very incredible magnitude of work that would come along with contact tracing and how labor intensive that would be when we brought everybody back, and just how much work that was going to take.
Thank you for that. Really appreciate that reflection. Kenneth, how was your year?
It's been an interesting year, as I'm sure we can all say. But first, I want to say thank you very much for having me. I'm very much enjoying being part of this panel, and Joaquin, I very much appreciated your opening statements. I think what I was very surprised about is how everyone was able to pivot in providing services for families. Many organizations were able to still provide services on a virtual platform, even when it came to things like physical activity and physical education. You saw a lot of organizations doing the best that they could to provide the needs that Eva was just pointing out. And then health became part of everyone's conversation, which was really exciting for me as a health advocate. So everyone was talking about building their immune system so that they can be stronger to fight against COVID-19, and getting proper exercise and changing their diet, and talking about these pre-existing conditions, right? And there's something that we've been talking about for a while about obesity and heart disease, and making sure you're taking care of your body, because we're talking about the long-term effects, right? But now we're talking about something that's much more immediate. And that is what I think really lit a fire under people to really be in control of their health. So in a way, it's kind of validated what a lot of us have been talking about in the health advocacy field, because health is the cornerstone of the human existence. And now, without that, people are seeing how susceptible they are to other ills.
Thank you. Each one of you has put a really fine point, I think, on what I hope is a fact for most people, that the education health connection at this point in time has probably never been clearer to more people, more families, more school administrators, teachers, so forth, and so on. And I'm assuming each one of you would agree that it's a connection that we want people to continue to prioritize, that health shouldn't, once, knock on wood, we move from the pandemic to a much more quote unquote normal way of living, that health doesn't get pushed to the wayside, once again, if it wasn't already, at the center. So I'm going to use a little moderator's prerogative, because I think this is actually a question for each one of you. From where you sit, what are the hurdles right now in the system and in how things are working and even how things are reopening and beginning to ramp back up? What are the hurdles that everybody who's online today should really think about and understand as it relates to maintaining that education health connection in a way that will enable us to sustain much healthier learning environments for all the kids that you work on behalf of?
One of the huge hurdles that I see to ensure that we get back to, I guess, a relatively normal, we'll never be back to the same standpoint, but many educational facilities and schools face a lot of budget reductions due to either public funding shortages, revenue shortcomings. So I think it's going to be really crucial for the support staff in schools, whether that be facility employees, custodial staff, the administrators, is to really put a plan in place so that we can support our teachers, our parents, in providing the best health and safety plans that we can. And I know for our particular campus, in order to return to full reopening coming up this fall, we're really going to work on our communication so that people feel comfortable. There's already going to be a lot of anxiety around returning to work, returning your children to school, making sure that we have the necessary supplies for disinfection and cleaning and indoor air quality and safe HVAC and other air systems filtrations. So we're really going to work on our employee training, our building inhabitant training, and communicate, publishing our cleaning and facility maintenance plans online through our social media, trying to have in-person, face-to-face conversations with our department heads and key staff and administrators, looking at posting social media messages such as, "We can't wait to get you back on campus." Whatever we can do to communicate what we are doing to provide a safe and healthy campus, I think is going to be key. Continuing to work with our business and finance staff so that we can maintain the proper inventory level so that we can meet the need in case there's any potential spikes. We have worked diligently with our campus health and university health and other environmental safety professionals on campus. So the contact tracing, while I'm not directly involved with that, we've had lots of communications around what do we do and how do we communicate what we're doing to keep them safe.
Really appreciate that. 2 points in particular. A plan sounds basic, but I worked in schools for 12 years, and I can't tell you that any school improvement plan that I was a part of had us thinking about student health, which is a really interesting and worrisome reflection. And communication is key, absolutely. Eva, Kenneth, how would you build on that?
Well, I would talk about the fact that already I think we see people backing away from as the CDC and as guidelines are updated and as the vaccine has come available, people backing off some of the the urgency that we felt early on in the pandemic. And Kimberly just said this: our lives are not going to go back to normal. We're going to have a new normal. And so for school districts, it's not, hey, the vaccine's here, we're back to the way that we did things. And I think it's a good time to reflect on the way that we did things before. Every year we dealt with influenza in schools. And why was it okay that we had 15, sometimes 20% of students out sick with influenza when we know the direct impact that has on learning? But from a systemic perspective, I think what the pandemic has highlighted, and you mentioned this, the gaps in our services, the disparities that exist, we know of the systemic racism, we know of the structural racism. And so when we talk about addressing those things, I would challenge us all to look at the structure of health in schools in general. School health Professionals aren't required to be on teams. They're typically not part of district administration. They're pulled in when there's a problem, but they're not at the table from the onset. And I think we've done a disservice in this country to recognizing we don't just need health professionals when we're sick. We need a foundation for learning, whether we're in a pandemic or not. And if you have a child at the very basic level that can't see or hear, then we're not going to teach them to read. And so we have to continue this partnership that we have with our healthcare systems and figuring out how to create systems that will let us do that. And I think that's a hurdle because I see things trending toward going back to what was normal, and normal doesn't need to be okay with us anymore. That old normal.
Really powerful. Kenneth?
Yeah, and I would, I'm just going to echo what the other panelists have said right before me. I think it is part of human nature to want to be comfortable, and to be comfortable, whether you were in a great position or not, is just to get to back what was familiar. But the truth is, normal didn't work for everybody. COVID has taught us a lot of lessons, and I'm concerned that we are going to fall back away from those lessons that we were taught. It has been a great pressure test on our systems, as some of the panelists were talking about. It has highlighted the food insecurities that families have, and it's exacerbated a lot of those issues. So anyone that was suffering from those issues before, were especially suffering from them during COVID. And we have this opportunity to highlight those issues in our society and do better by the people that are most vulnerable. And if we really want to give birth to a new society, one that is equitable and works for everyone, we know birth is messy, right? It is not comfortable. Well, I'm sure most of you know better than I would, of course. But that is something that, there's a beauty on the other end, right? It is worth the process. So I would urge us all to not just to resist our need to go back to what was comfortable, because again, normal didn't work for everyone. A lot of us were left out.
Normal didn't work for everybody. That is absolutely 100% true. And if I could, Kenneth, could I deepen, or ask you to deepen a little bit what you were just talking about right now? You've spent so much of your career as a community advocate, working with the community in your roles in schools and outside of schools. And so I'm wondering, could you share with our panel and also everybody online today, what are you hearing from folks in the community, from families, from community advocates, about unmet health needs and the ways that schools and school systems need to respond to those on an ongoing basis? What's changed since before the pandemic that school system leaders really need to understand in order to get this right for kids?
I think not a lot has changed, because frankly speaking, Black people are used to going it alone. Like, we've been forgotten. We've been left on the sidelines since the inception of this country, right? So there isn't that expectation of relief. We 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 tend to see improvements in our neighborhoods as signs of gentrification, because that's what it's been. So anytime help does come, ultimately it doesn't feel like it's something to benefit us. It may benefit the buildings and the communities or the next residents, but not necessarily us. So Black people have always been resilient. They've always been able to come together and help themselves and stick together in their close-knit communities and families. And I think you've seen a lot more of the circling of the wagons, so to speak, and just like building on that resiliency. And I think we need to understand, what I would want administrators and healthcare professionals and everyone to understand, is that mentality. And it's not a mentality of stubbornness, it's a mentality of wisdom. This is what the country has shown us, and you have to come to the table understanding our history and what we've had to deal with. So if you want to be able to get through those barriers, then you're really going to have to come with your heart on your sleeve, and you're going to have to prove yourself, and you're going to have to be patient.
Ken, that really powerful reflection here, and Kimberly and Eva, it's telling me Kenneth is communicating two things, I think, to me and to everybody online today. One, systems and institutions have a credibility problem on their hands, particularly relating to Black, Brown, and Indigenous communities. That's number one, and number two, credibility problem, as well as not a history of not engaging people in this work. So from your perspective, working in important institutions in the lives of young people, what would you say to institution leaders about how to address the credibility and the voice and engagement challenge that obviously has been laid bare by this pandemic, but has existed for hundreds of years?
Let me unmute myself. I know from the University of Georgia standpoint, which is the oldest public institution in the country, we have worked really diligently during this pandemic to highlight the importance of our frontline employees, many of them being our building service workers, which is what we call our custodial staff here, our groundskeeper, some of our other people who, unfortunately, they couldn't do a lot of their work at home under remote policies. And many of those are people of color. So making sure that we have had a focus on diversity, inclusion, and equity throughout this campus. And in particular, we know that there was quite a bit of vaccine hesitancy. So trying to communicate having a healthy staff. And if you are a healthy employee, that means that you can get the medical services that you need so that you can take care of your own personal family, so that while you're at work, you can be a little bit more comfortable focusing in on working and not having to be worried about the status of your health and your family's health. So we really tried to communicate that and provide those resources. Also, in mental health, providing those resources to our staff so that they would know where to turn to if they needed someone to talk to or to share in some of the difficulties that they may be having on a personal level. And so, from that university standpoint, we've looked at it from that point. In a previous position, I was executive director at Clark County School District, K through 12 institutions. And again, most of those frontline employees are people of color. And so I think one of the important things to address is making sure that we have that communication line. And number one, let our staff know that they are valued. What they do has dignity and importance. And when they feel prideful of their jobs that they do, they support student health, student well-being, providing healthy and safe spaces for these students to learn and for our academic staff to provide the service, which is to help them get educated, help them graduate, and help them feel good about where they work and learn and study.
Great, thank you for that. I really appreciate that focus on adult wellness as a way to promote young people. Eva, what would you say about that?
I would say really just building on and adding to what Kimberly has said from my perspective as being responsible for nursing services. So the first group of folks that we brought back were our frontline workers, our critical staff, and that was so I'm going to say humbling to me, because these were the folks that were coming out, boots on the ground. They were when all the anxiety was present, and they were so good at communicating with me when there were gaps in communication, when there are things they weren't sure about. And I learned firsthand, of the challenges some of our folks had with accessing technology and the way that we do business generally that isn't necessarily getting to all of our populations. And that, again, was learning for me, and it also helped prepare us for bringing children back and some of the struggles that our families would have. And so that's one thing I would say. The other thing I would say from an institution's in this country perspective is that there's more data. When we're talking about the educational success of children, there's more data to look at. And these disparities, we've talked about all the disparities that existed pre-pandemic. And so we know that they're going to be even worse now. Many of our kids have lost a year's worth of instruction time. And I've told people just here in our area, we struggle with our children, our Black and brown children, and their reading levels compared to their peers. And why did that gap exist in the first place? And then when they're not reading at grade level, that's the next that's a public health crisis in and of itself, because that sets kids up when they don't finish school, they don't go on to have an education. That's the riskiest thing that can happen to their health. And so we've got to do better at intertwining health and education. We've got to do better at making sure we're addressing the health as part of their education, and that when we're looking at reading and math scores, we're comparing that with, do they have health conditions? Are they coming to school? All those health-related factors that really impact their ability to learn.
Yeah, absolutely. I really appreciate that. Again, that focus on the whole child, and really connecting the educational piece with the health piece and the long-term wellness of a young person. I think that's absolutely the logic model that everybody needs to put front and center in all of our work today. Before we turn to questions from the audience online today, I'd like to, and this might be a little tough, I recognize it, but I'd like to see what silver linings might be out there that could give people who are learning and listening today some amount of hope and assurance that maybe there are some positive steps forward here on maintaining a strong education health connection in service of the whole child. So I'd like each one of you to be able to share with our audience today, what are those bright spots? Who are the innovative institutions? What are the smart practices and policies? Who are the people out there that are pushing in the right direction that we all should be learning from?
From an educational facility standpoint, some of the bright spots that I can share out is it's important to create huddle groups, whether that be with your health professionals, your medical professionals, other distributors, vendors, other campus partners who are exhibiting best practices. There's a lot of really good resource information on the Healthy Schools Campaign website for educational professionals to turn to. I know for myself and other partners, we have shared our reopening documents. We had a 280-page document where at the university we went through each and every aspect of, what can a teacher or a professor do if they feel as though that they need extra disinfection in their classroom, if one of the students or another employee has reported that they have a coronavirus, what to do if there are employee needs, what services are there, what additional resources can you order from our warehouse, what is the HVAC filtration standard that we use across our campus, what are the mechanical systems that could be impacted and might provide some question around indoor air quality for your office or your lab or your conference room. Just trying to provide that information, gathering resources like the documents that we have shared out, whether it's for a university or a college, K through 12, looking at best practices and then seeing how you can take that information and apply that to your situation in your school, I think is very important. So that communication is very strong. Working with distributors, demanding that they provide green cleaning resources if they have a sustainable operation plan, so that you can always find what you need, be able to have your business partners on board with where you want to take your facility operation, and making sure that you are a very vocal and important player in the game to provide the best health and safety practices that your customers, whether they be your students, your parents, or your other staff and faculty members, know that you have their best interests at heart.
Thank you. Appreciate that. Quite a nice roadmap for how to do this well. Eva, Kenneth, what would you say are the bright spots from your perspective?
Well, I would say that when this started, there were barriers that have been in place for a very long time that were instantly just done away with. And so it allowed us to do some things working together the way that we should be working together, again, across disciplines. And so that's one thing I think was incredible. Telemedicine, the ability to provide those services, which, Kenneth mentioned that we could do things differently, and it was okay to do that because we were challenged to do that. I would say community partnerships, and the other panelists both have been talking about conversations that hadn't taken place in the past have been a very just a silver lining. In my district, we have added 100 school nursing positions so that we've placed a nurse in every school, and I think that's paramount to the success of bringing our children back to school, and even the national attention that has been on health. Again, I hope it doesn't wane. I hope this is a wake-up call and a new normal for all of us. But building those community partnerships, those national partnerships, have been a wonderful thing that has come out of this pandemic because, again, we've put the children and families at the center of the work.
And I think, I'm sorry, go ahead.
No, please.
I think a silver lining for me is that this pandemic is evidence, and our responses to the pandemic is evidence that anything is possible if we work collectively and with intention. If you'd have told me in 2019 that everyone across the globe is going to stay home as best they can and social distance, and we're going to close the stores on all the businesses in the United States and in this capitalist country, how are we going to close businesses for a year? And of course no one's going to do that. That's not going to work, but we found a way, right? So we started, as Eva was talking about, the telehealth. We're doing different kind of community outreach to educate families on best practices to maintain their health. We created mobile vans to get the vaccine out into communities. So we started doing all of these things that would have seemingly been impossible, that would have taken 4 or 5 years of meetings and conversations, and we did them in months, right? One thing I'm especially proud of is I'm working with a collective of growers here in Chicago called Chicago Grows Food, with the highlighting of the food insecurity due to the pandemic and the lack of being able to get to the schools and access of the school gardens. A lot of those partners that provided that came together and developed grow kits that we delivered to families. So we delivered seedlings and grow bags and everything they need just so they can have that connection to nature and still trying to break down that barrier in the food system, having that access to food. So we having people across Chicago growing their own food. And of course, that is not the answer. Growing a couple lettuce plants is not going to feed your family and be sustainable, but it's a start. It's planting that seed of that change that we can make in our food systems and the way that we do things so that people aren't as vulnerable as they were before. And as hard as we think these things are, COVID-19 and our response to it has shown us that anything is possible if we truly just want to change things.
Amen to that. I don't think there's any better way to put it. I really appreciate everyone's deep engagement in this conversation, and I hope the audience has been listening to the tremendous perspectives and insights that each one of you has offered. I think I am now turning it to my colleague Alex at Healthy Schools Campaign to take the next portion of our discussion.
Great. Thank you so much, Joaquin. And I just want to echo Joaquin's comments. Thank you so much to the fantastic panelists for just your incredible, thoughtful remarks throughout the discussion. So we're now going to transition to the question and answer portion of the webinar. We've had quite a few questions come in. please do not hesitate to keep sending in those questions of our panelists. We would love to ask them in the remaining 15 or so minutes here. So a first question, Eva, is going to go to you. I know we have a lot of school nurses on today, and just given the incredible advocacy work you've led around school nursing services, I wanted to send the first question to you, which is just given the critical role that school nurses play in the health of school communities, what plans are there to ensure that all students pre-K through 12 have access to a full-time school nurse when we know that that's just was not the case pre-pandemic? And I know you mentioned the work you've been leading to put a school nurse in place in every school. So would love to hear a little bit more about how that happened and just any advocacy tips you have for others that are looking to really bring in more school nurses to schools.
So really, in my own district, it was a matter of community asking questions about who would be available when students came back to school. And it was part of our processes in trying to think through how can we do contact tracing for this many people and do it effectively and do it well and be able to respond very quickly. So we had a lot of learnings from when we brought staff back. And I've had weekly, bi-weekly often meetings with our health department as we worked on plans to bring kids back to school. And so our administration made the decision that nurses would be well suited to be in the role. We wanted on-site testing, COVID testing available for students so that when we had very strong plans, guidelines for bringing kids back to school in Kentucky. And so as part of those, that rapid response is critical to halting spread of COVID within our facilities. And so we saw school nurses as being very valuable and critical to that work. And I hope that we can continue to build on that. I've done budget requests to do this for at least the next 2, maybe 3 years, and then we'll reevaluate the model looking forward. So I would tell everybody is to look to those funds that have come from federal funds. If you bill Medicaid for your nursing services, you won't be able to bill for those who are federally funded, but we'll have some of our staff that are funded through general funds, and so we can recoup some of that and try and grow the program. Kentucky, our state nurses association, which is a different association than our school nurses association, which we have as well, but our actual state nurses association has taken on the initiative for having a nurse in every school. And so they have been, that's been on their legislative agenda. And so there's been a lot of support in the state of Kentucky as well for trying to move forward to make sure that every child has access to a school nurse, because that person is a critical care coordinator, person to work between families and healthcare providers, and all those things that we needed to be doing anyway are very glaringly clear now. In the Institute of Medicine's Future of Nursing report, school nurses are mentioned 87 times. And so they're a critical part of our healthcare system and have been for years. And we need to be more vocal about making sure that every child deserves to have that access and opportunity.
Thank you so much, Eva. Hear, hear. We could not agree more with those remarks. Thank you for sharing that. Kim, we've had a few questions come in. I know you mentioned some work that you're doing on your end to support mental health among your staff members, and just in general, this idea of also supporting staff wellness, which I think is just such a critical need that often, unfortunately, gets overlooked. So wondering if you could say a little bit more about what that programming looks like to support staff health, and would invite any other panelists to weigh in on best practices they've seen around supporting staff health as well.
Yes, thank you, Alex. Well, we have really tried to work hard, and it's not just our department, it's throughout the university. So it is a university initiative, and it is certainly one that is supported through our university system. So we have it where any employee can go on to our online portal, same regards like a telehealth type of situation, and talk to counselors. And they can talk as long as they need to. So there's no limitations on that, which I think is important, because sometimes, you know, if you're going through your insurance plans, you might have some limitations on how long that can be. providing some of those services so that they can have a full palette of various things that they can choose from, and whether it's financial planning, whether it's, how do you do childcare, what are resources for employees who might need to stay at home with their students and try to work through, school lessons. Just something as simple as that, and the stress that it goes to. So there's quite a number of different resources. We have all of that listed on our university website, if anyone is interested in that, in University of Georgia website. But I just think it's important that a lot of times there are programs in place, but as supervisors, as leaders, continuing to highlight that to our staff takes some of the stigma away from them having to use those. So I think that's equally as important, making sure that our employees, whether they're our frontline employees, all the way up to our supervisors, department heads, know that there are places they can turn to for assistance, and just having that care, that we are concerned about them as employees and their wellness, then they can do a much better job, feel more comfortable when they have to, perform.
Thank you so much for sharing that, Kim. That's really helpful. Any others on the panel have thoughts on the staff wellness piece?
I just wanted to.
Oh,
sorry.
Go
I
ahead.
just wanted to highlight. Thank you. Sorry. I just wanted to highlight. As far as like staff wellness, I would say just making sure, to all the administrators out there, making sure your teachers are having time to check in about their mental health, and about what they're like how they're coping with things that are a result of COVID-19, or maybe other things like the social justice that are going on in the world. It is very tough for people to focus. I know I've been having a difficult time personally. So it's kind of hard to like focus on the different things that you need to focus on and like do your job to a certain level when like you turn on the news and you get these updates on your phone and stuff like that. It can weigh down on people. And then especially if you are um, are blessed to have children in your care, like, and to have to put on a brave face every day. I can only imagine how tough that can be for teachers and other frontline workers. So just making sure that staff and everyone else has a space to vocalize how they're dealing emotionally, mentally.
I would just add, I'm fortunate in our district, we have a strong department that for mental health. And so part of the reopening plan was to make sure there were systems in place for staff to help meet staff needs as well. The other thing our district did as part of the reopening was develop an equity reopening plan. And so there were measures put into place to address physical and mental health systemically, with the intention of being very intentional about an equity, and doing that with an equitable focus. And the other opportunity that's really come from this, and for everybody who's on the webinar, our school-based health centers, some states have more in the way of school-based healthcare than others. It's opened up a lot of doors for us to expand, at least in this area, and mental health services are some of the services that they provide, and we make those accessible for staff as well. And so that's just another way to normalize health as part of education for both our students and staff.
That's great. Thank you so much for sharing your thoughts on that question. That's really helpful. I think we have time for one more question, which Kenneth, I'm going to pass one over to you. I know there are a lot of family members of students in K-12 schools on today, and I'm wondering what advice you would have from them just around engaging in the decision-making that's happening in their school or district around supporting student health as students return to in-person learning. I think particularly, as Eva mentioned, there's significant funding coming into school districts that can be invested in a range of programs. I think there's just tremendous opportunity right now to inform some of the decision making. So would appreciate any advice you have on how families can make sure that their voices are a part of those conversations.
Oh, definitely. I'm glad you asked this question. The first thing I would say to the parents is remember that no one loves your babies more than you. So stay there, like like operate in that. You are your child's biggest advocate. Um, Figure out how I would suggest that you figure out how your school works and where you can get in. In Chicago, we have committees like the local school council that parents are required to be a part of. That is a space for you to be there. Even if you are not a member of the local school council, you can still go to those meetings. Those are public meetings that you can be involved in. A lot of schools have parent action committees. That is another way you can get involved to make sure that your children are getting the resources that they need. Some schools have wellness teams. If your school does not have a wellness team, feel free to start one. And like, don't let anything hold you back. Like, be involved. Schools perform better when parents are involved. Like, that's studies show that. So be there for your students. Find the ways in which where the system allows for you to take part. And if you can't find a way where the system allows you to take part, make a new system. Like, change the system. It is imperative that you play a role. Um, and and who else is going to do it? Right? You're the parent. Like, you've got to be there. So I encourage you to figure out the how everything operates, whether you have to go in with a teacher, the administrator, um, whoever's the head of the district or the region, however your things work out. So yes, so I suggest.
Great. Thank you so much. Excellent advice, Kenneth. So with that, I'm just going to move on to closing remarks. Stephanie, if you could put the slide deck back up. I just want to once again thank our fantastic moderator. A huge thank you to Joaquin, as well as our panelists. We so appreciate you all sharing the incredible work that you're leading around supporting student health and wellness and return to safe and healthy in-person learning. So before we wrap up, I just wanted to take a moment to highlight a few resources that underscore a lot of the lessons learned shared today. Healthy Schools Campaign has created a series of these resources to really support the return to in-person learning. So this first resource, which is up here, which Eva helped inform as well, highlights a lot of the lessons learned from states and school districts around supporting their efforts to continue delivering health services during school building closures. So encourage you to check that out if you're interested in learning more about telehealth and issues around Medicaid claiming for school health services. And then on the next slide is a guide that's specific to Chicago, but I think really offers a helpful framework for understanding if your school is taking the right steps to keep students safe. And so it has a lot of fantastic information in there as well. And on the next slide is a resource that underscores a lot of the fantastic points that Kim raised and really provides actionable best practices for safe and effective cleaning and disinfection in occupied spaces. And then on the next slide, we also at Healthy Schools Campaign had the opportunity to collaborate with Kaiser Permanente and a host of other national partners, including National Association of School Nurses, around a playbook for return to safe in-person learning. So it has some great information on everything from staff wellness to mental health and wellness to COVID mitigation. So some great information in there as well. And on the next slide, all these resources and many resources from our partners are housed in a resource center on Healthy Schools Campaign's website. And we'll be relaunching this resource center with new resources that reflect current public health guidance in the coming months, but encourage you to check that out. And we will be sure to send out links to all of these in the follow-up email. So with that, I just want to once again thank our fantastic panel and thank everyone for taking the time to join today's session. We so appreciate you joining and hope that you enjoy the rest of your afternoon. Thank you, everybody.